Make lifestyle choices to enhance your well being. This is Natural Inspirations. You are listening to Natural Inspirations Podcast, the show where we have conversations with local natural health experts on the Space and Treasure Coast. Welcome to episode 38. I'm Chris Urquhart. Today we're talking to Dr. Chandra about genetic testing for cancer and when it might be right for you.
So, hi, Dr. Chandra. Thank you for joining me today.
Thank you for having me. It's a pleasure.
So, I'd like to explore the topic of genetic testing for cancer. As a medical doctor specializing in oncology and hematology, you have a special interest in genetic testing. And can you share what are some of the reasons a person might consider genetic testing for cancer?
Well, this has become an emerging and more important field within oncology, especially as we discover more and more inherited cancer syndromes. So if a patient comes to us who has a history of a cancer, which is, unexpected, especially if they're young or if they report an extensive family history of cancer, it's become more and more important, increasingly important, to test for any genetic abnormalities, inherited cancer syndromes, because it can affect management. An example would be if we see somebody for breast cancer and they are deciding between having a mastectomy versus a lumpectomy, which is a less invasive surgery than a mastectomy. If we test them for an inherited cancer syndrome, and if they happen to have one, then they may opt to pursue mastectomies, bilateral mastectomy, rather than breast conservation therapy. So as a result, we're doing more testing as we're becoming more and more aware and educated about different cancer syndromes. So it does play an important role in the management of a patient with cancer.
So, I think breast cancer is one of the cancers that come to mind when we talk about genetic testing for cancer. Are there some cancers that are more appropriate for genetic screening than others?
Not necessarily. It's more knowledge based than whether they're appropriate or not. We just know more about cancer syndromes that are associated with, say, breast cancer, uterine cancer, ovarian cancer, colon cancer, are the ones that were discovered early on. But as we're learning more and more, we know that there are other rarer types of cancers that may have a genetic component to it. Melanoma is a good example, where someone with a strong familial history of melanomas, we will test for cancer syndromes. And if they have one, they go through more rigorous screening for melanomas than someone maybe who doesn't. And we're also finding an association between different cancers as well. So if a person has, for instance, the most commonly known genetic cancer syndrome is the BRCA mutation. What we know now that that can be associated not just with breast cancer and ovarian cancer, but also pancreatic cancer, prostate cancer in males. So that's the reason why it's becoming more sort of widespread testing, not just based on certain cancers.
So, what I'm hearing you say is it's helpful for a patient who's undergoing cancer, maybe make different choices than they would have
Yeah.
without the knowledge. And then for family members, having the knowledge may lead to more frequent screenings for cancer so they can
Ab-
get ahead of it. Is
ab-
that accurate?
Absolutely. Yeah, absolutely. I mean, if we discover that there's a cancer syndrome in the family and siblings or children get tested and do have that syndrome, then yeah, you could potentially save lives because, obviously prevention and then catching anything early is the best way to fight cancer, to treat cancer.
Are there any lifestyle changes that you recommend based on finding genetic predispositions for different cancers?
I mean, we don't really know definitively about diet, and I get a lot of those questions, what's the healthiest diet or what's the best diet to prevent cancer? And we don't really know that yet. The one thing we do know does prevent cancer is exercising regularly, and we don't know why or how, but it's been shown over and over again through multiple clinical trials that regular exercise does somehow prevent cancer. So that's the one thing I sort of advise people to do more than anything else.
Right. And of course, we know it helps us in a lot of other ways too. So
Right. Aside
that's
from the all the
kind
other
of a
benefits.
win-win situation, isn't it?
Sure. Yeah.
Is there a downside to getting yourself screened? For example, your family member, you then find out that you have this genetic predisposition. Did I?
Well,
Going
it
into a
can lead.
state of fear probably isn't the best solution.
Yeah, I
How
mean,
do you
that would be the
mitigate that?
biggest downside is anxiety. If you have a family member who's discovered to have a cancer, inherited cancer syndrome, then yeah, it can lead to a lot of anxiety. The downside could be, one of the downsides is those folks may be subjected to more imaging studies, routine CAT scans, different tests that can come up with, you can find things that may not be clinically relevant, but now you have a significant amount of anxiety about finding something that may not be related at all to cancer, but could cause anxiety. So I think anxiety is probably the biggest downside to it. But again, I think the benefits of knowing and the possibility of preventing cancer far outweigh anything else that may happen as a result of getting tested.
Are there some mitigation things in place, like counselors, perhaps, genetic, or the people who are
Yeah,
this that help you work through it if that's your situation?
absolutely, and that's become the role of a genetic counselor has become more and more important. The technology and the knowledge is changing and progressing so rapidly that it's hard to keep up, to be honest with you. So it is important to either have someone on staff or at least be working with a genetic counselor, and they can certainly allay fears and also advise us in terms of what appropriate testing should be undertaken for those folks as well. So that can all help. Having a team approach and that kind of thing really does help with allay some of the fears that this can cause.
So genetic testing is becoming, or types of genetic testing is becoming more available in at-home kits. Is this the kind of thing you do in an at-home screening, or does it need to be administered by a medical doctor?
No, the test we would recommend would be provided in a physician's office after having undergone counseling. The at-home kits, I don't think they're not even actually allowed anymore to test for cancer syndromes. Just concerns about how accurate they are, and this is really a big undertaking and a big decision. You really have to have a healthcare professional advising folks through this, talking to them before they get the testing. An important thing to ask anybody who wants to get tested is, okay, if we find something, what would you do about it? Do you want to know? Those kinds of things. So yeah, all the FDA approved tests are usually prescribed by healthcare providers.
Good to know. Well, thank you so much for sharing your insights and your expertise with us today. I really appreciate your time.
Thank you for having me. It's been a pleasure.
And for those listening, be well, stay connected.